Hi, welcome to this discussion on ethical dilemmas in healthcare. In this video, we're going to talk about the issue of informed consent, which is a critical aspect of medical treatment and research. Informed consent is a process by which patients are fully informed about the risks and benefits of a particular treatment or procedure, and they are given the opportunity to ask questions and make an informed decision about their care. For example, if you have a cardiac condition such as an atherosclerotic plaque in a coronary artery, you may end up having a stent placed or a coronary artery bypass graft performed. Both of these are surgical options that are highly effective, but also carry a range of inherent risks. Ensuring that patients are provided with the information necessary to make that informed decision is critical. In fact, informed consent was a term first used in the United States Medical Malpractice Court case in 1957. Since that time, it has been accepted into international law by many fields, especially related to any work with living humans. However, the issue of informed consent can be very complex, particularly in situations where patients may not fully understand the risks or benefits of a treatment, or they may feel pressure to undergo a procedure. In some cases, patients may not have the capacity to give informed consent, such as in cases of severe illness or mental impairment. In others, factors such as a lack of education create a barrier to a patient being able to fully understand both the risks and benefits of the procedure they need. Please note that barriers to treatment, such as education, are something we will explore later on in this course. While informed consent for a common or widespread treatment may already be tricky, it becomes even more difficult in research. The issue of informed consent is particularly acute in the case of medical research, where patients may be asked to participate in clinical trials or other studies. In these cases, patients must be fully informed about the risks and benefits of the study, as well as their right to withdraw at any time. However, in these cases, we may not truly know all of the potential risks and benefits, as that is the part of the purpose of some types of medical research. To be clear, human trials are never done without any knowledge of the risks and benefits of a treatment, but we don't know exactly what will happen in humans until a human is the subject. One big question in all of this is, how do we ensure that patients truly understand the risks and benefits of a particular treatment or procedure? And what happens when patients are unable to give informed consent? The issue of informed consent is a critical aspect of healthcare that requires careful consideration and attention. It is critical to ensure that patients fully understand the risks and benefits of their care and are given the opportunity to make informed decisions about their treatment. But we must also be mindful of situations where patients may not have the capacity to give informed consent and work to ensure that their rights and interests are protected. With all of this in mind, here is your ethical question for the journal. If a physician is not 100% certain that a patient can provide informed consent for a treatment, but the treatment has low risk and a high probability of improving the patient's quality of life and lifespan, is it morally right or wrong to treat the patient? For this week's ethical question, I want you to approach it in two ways. First, provide the stance for Kant's categorical imperative. Second, provide the stance for utilitarianism. Make sure to clearly identify each viewpoint, its stance, and defend the stance taken.